Hi guys, it's X. Welcome back to my channel. In today's video, I'm going to be talking about my first year as a nurse practitioner. I have 1 year down. I learned so much this year. So this video is basically going to be about what I went through, my transition, things I wish I learned, things I wish I did differently, things that I've learned, questions that I'm always asked, and basically just my journey as a nurse practitioner. So if you want to know what that was like, just keep on watching. But before you swipe me away or click me out of this video, don't forget to hit the like, comment, and subscribe. Thanks. Okay, I'm gonna start off by saying I know I am one of the luckiest people out there. I thank God because my transition from a nurse to a nurse practitioner was very, very simple in the sense that I got my dream job right away. I got the first job I ever applied to. So how I got so lucky was that one of my preceptor sites from school actually happened to be expanding their practice. My pugs are playing in the background, so I apologize for the grunting noises. But anyway, one of my preceptor sites happened to be growing their practice, and I do work at a level 1 trauma center in trauma general surgery and ICU, and I also work at a teaching hospital. So I work with residents. I have an attending. So I just got so lucky. Trauma is near and dear to my heart. So it is literally everything I could ever ask for. I also asked because I did not want to give up my nursing job. And if you watch the previous video, I admit that I became a nurse practitioner for the wrong reasons. I really wanted to intubate and place lines and do procedures, and that was the whole reason why I went to school. But I thought this was something that I could put on the back burner. I was never ready to leave bedside. So when I graduated with my NP's license and got everything settled with the board, I didn't have any intention on actually working right away until I realized that in order for me to renew my license, I actually do have to work right away, because I was like, if I wait, who's gonna hire me down the line? So when my preceptor actually reached out to me and told me they were growing their practice, my site is actually 2 counties away from where I live. It is very, very far. So I told her, I'm willing to apply if you'll give me part-time, because in my head, I was like, I'll be part-time as a registered nurse in ICU. I'll be part-time as an NP. I'll do 4 days a week, and it'll be great. And the reason why I thought that I would be able to accomplish this was because working the 36 hours a week straight, felt like I was starting to get burnt out as a nurse. But I figured by the 4th day on my day off, I was always bored and couldn't wait to go back to work anyway. So I was like, 48 hours a week shouldn't be a big deal. But there was actually no part-time position. It wasn't a thing at this facility. And so after months of negotiating, they actually gave me the position. So I got my dream job, NP job in trauma, in ICU, and everything I could possibly want, this company facility gave me. So I know how lucky I am. However, I mentally struggled, and part of that was because I had to work for 5 to 6 12-hour shifts every week for 6 months because I didn't want to give up my nursing job. So that contributed to a lot of mental health issues, because I love being an ICU nurse more than anything. And I've been asking for a year, when I first knew that I was going to apply for this job, to go part-time at my job, and it took me a very long time. I finally got to the point where I was just very sick. I was working so much. I was very unhappy. I was putting on a lot of weight. My health was not good. At the end of the day, I just felt like I was just not in a good headspace, but also physically ill. I felt like I wasn't in my body. There was times where I was just, let me tell you how my day went. I would wake up at 3 a.m. to be at my job at 5:30 in the morning. I wasn't off till 6:30. And then with traffic, I wasn't home till sometimes 8 or 9 p.m. So that was almost an 18-hour day. I was doing that 2 days a week. Sometimes I was staying at a hotel so that I didn't have to come back, but then I missed my husband. I had just gotten married. We had just moved in together, and I left. My husband had not lived on his own previously. So I literally married this man, had our 5 animals here, and like left him 2 days a week to be at this job. So I felt really bad. Like my husband did take a lot of housework and, you know, stuff on his shoulders because I was gone. And then I would come home and I was always tired. And like, I just felt like those 1 to 2 days off, I was just recovering and just so sleepy, and mentally I was like, I can't do this anymore. It got to the point where I was like, I was so upset because I like being NP. I don't love it as much as I do being a registered nurse. So I was like, kind of mentally fighting with myself because I was like, I really love my nursing job. It is the best, happiest job I have ever been at. And I didn't want to give it up, but they weren't giving me a part-time position. And then at the same time, I was like, well, I don't really like being an NP as much. It's very far. However, if I don't do it, like when I went to school for this, and like, what if I'm like stopping myself from being something that I could be really potentially good at? So I was like, I didn't know what to do. But anyway, I ended up getting my part-time position at both jobs. I stayed in both. And even though I cut down to 48 hours a week, so I was working 4 12-hour shifts, it was just too much. I learned that no amount of money, I was making such good money, but no amount of money is worth your happiness. And I was just so unhappy because of how tired I was. The 3 days off that I had, it was literally just recovery, errands, barely got to see my husband. So I finally asked my NP job if I could go per diem, and they said yes. And I was so thankful and grateful. So let's talk about why I could have told you this in clinical. Being a nurse practitioner, I like it, but I don't love it. It's not for me. And I knew the moment I hit clinical. Unfortunately, I didn't hit clinical until the end of my rotation. I'm sorry, until the end of my like schooling. It was like the last year of schooling that I did all my clinicals. I could have told you the first day that I just knew being a nurse practitioner wasn't for me. I love doing procedures, but that's like 5% of my job. The rest of it is sitting behind a computer, like rounding and doing notes. And I just personally, my personality, that's not what I like to do. I'm very tasky. I love being hands-on. I love being with my patient. I love watching them progress. And I love being in critical situations. Like, I just love titrating drips. And like, I don't know, it's just personally something that I prefer to do. I am always the type of person that can't sit still. I have to be constantly moving. I have a very bubbly personality. I swear I have probably ADHD. Like, I just can't sit still. So for me, being an NP is very different. It is a very different role. I spend a lot of time reviewing charts, seeing patients for probably 5-10 minutes, and then the rest of my time is spent writing notes and orders and talking to nurses and families. And it's just not something I could see myself doing forever. I like my job and I love the people that I work with. I love having like interns always working with me. I love vibing with them and like talking to them and like brainstorming off them. I love being at a like level 1 teaching facility where I get to see like rare cases and crazy cases, and every surgeon that I work with is absolutely amazing and they teach me so much and I've learned so much. But at the end of the day, it's just like, I like it, but I don't love it. I love my like the people I work with, but like it's just not the same. So yeah, one question that I always get asked now that we're on that topic is, well, do you feel like this is a waste of time? Do you feel like if you go somewhere else, you would like being an NP better? Like, what if you try a different specialty or a different setting? And the answer to that is no. The reason why is because I absolutely love trauma. That is my favorite type of nursing. Every time I am in the ICU as a registered nurse, that is my favorite type of patient to get, is trauma. I love the fact that you have to deal not only with the physical, but like these patients were previously healthy, most of them, and then one day a series of unfortunate events happens and then you have to deal with mind, body, soul. Like, there's just so much that goes into it. So that I really love that aspect of trauma. And so and this is my dream job. So I don't feel like going to a different specialty or a different type of setting would make me like it more, because this is what I like. It's just the job itself. Like, the note writing all day. I don't want to do that. I want to be titrating the drips. I want to be hanging stuff. I want to be doing things. And like I said, I became a nurse practitioner for the wrong reasons. I really wanted to do procedures, but I didn't realize procedures were like 5% of my job, and every procedure I do comes with a note. So, yeah. And then people ask me all the time, well, do you feel like this was a waste of your time? Do you feel like this was a waste of your money? And I'm going to flat out say, absolutely, it was not a waste at all, because I always looked at this. One, you guys, I'm from the projects of East LA and Boyle Heights. Higher education was never even on my radar as a kid. I didn't even care to have a bachelor's degree. Like, I didn't really care to have higher education. I wanted to be a cop, to be honest. Like, I thought I was just gonna, like, school was a backup plan for me. I never cared to have a bachelor's. My parents never pushed me to have higher education. College was never something that was like forced on me by my parents. My parents always were like, do something you love and go with that. So to me, growing up in East LA in the projects, like, I never even imagined that I would be a college graduate, to be honest. And so when I first got my bachelor's, I only did it as a nurse because I was like, well, they said they're going to change laws and I have to be more marketable. And if I want to work at a magnet facility, like, I'm going to need it. So that was the only reason why I did that. But then once I worked at a level 1 trauma center where I got to see interns and like they motivated me to go back to school, like, I was like, oh my God, I could do this. I want to do procedures. Like, this is so awesome. So that's why I ended up getting my master's. So I don't see it as a waste, 1. 2, I have 4 degrees now. I have no debt. I worked full-time while going to school. I never took out a loan, so I don't owe anybody anything for my education. 3, I always looked at this as, even if I don't use my NP license at all, it made me a better ICU nurse. It's gonna make me a better nurse. And that has proven to be factual. So do I feel like it was a waste of time? Absolutely not. I have a degree now. Not only that, what I love about my situation, I have the option of walking away from a career because I want to, not because I have to. I have an option of pursuing this later on if I wanted. I mean, I'm still doing it, but like, I just have a variety of different things that I can do with my career now because I have this. So even if I decide tomorrow I don't want to be a nurse practitioner, or what if I decide tomorrow I don't want to be a nurse anymore, I'll stick to being a nurse practitioner, I have options. So I don't see it as a waste at all. Some people don't understand that, but that's okay. That's how I've seen it, how I see it. So another thing that I wanted to say, because I see a lot of I talk to a lot of nurse practitioner students, and they also are in hopes of keeping their RN job and working like part-time or per diem as a nurse practitioner. And to be honest, I wouldn't recommend it. Even though I do it, I wouldn't recommend it. And the reason why I wouldn't recommend it is because I feel a lot of my hardships that I have transitioning from a nurse to a nurse practitioner was because I was part-time. When I started my job, we all got the same amount of training. We all got like a month and a half with a preceptor. But because I was there half the time, I got half the amount of training. And I felt prepared to be on my own, but the only thing is, like, I don't know what's going on at the facility all the time. I'm not at all the meetings all the time, and we have a lot of them, and I'm not there all the time. So like, I don't get to see the patients day to day like I would if I was there 4 days a week as my coworkers are. So every time I go, I feel like I have a new list of patients. I have to get to know them. And like, as a new grad, I think that is just something that you will struggle with. And so my struggles came from the fact that I chose to, 1, work far, very far, and 2, I chose to be part-time. I chose to be per diem. Now I'm better. I am mentally like, can go get my list of patients and just do my thing. But it definitely was a struggle in the beginning, especially when you're not there all the time. So I definitely do not recommend that. If that is your plan, it is going to be very difficult. Another thing with that is scope of practice. So a lot of people have asked me, are you scared of like one day going to court? Like, you know, you're going to be held to your highest degree. I am very, 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 very good at knowing my scope of practice in each role. When I go to each job, my mindset is completely different because I know my scope of practice as a registered nurse, and I know my scope of practice as a nurse practitioner. So I don't cross those roles. I do not like go out of line whatsoever because of that fact. And like I said, when I go to my nurse practitioner job, I have a whole different mindset. I have a whole different flow of my day. When I go to my registered nursing job, it is also completely different. So I am not worried about the fact that I do both, or if I ever have to go to court one day, or being held to my highest degree. Another question along with that kind of ties into that is people ask me, do you ever, when you're at your nursing job, get frustrated if you feel your patient needs something? You know, as a provider, your patient will benefit from this, but the provider who is taking care of your patient won't give it to you. And the answer is no, I don't find it frustrating because every provider is different. Yes, we have guidelines and standard of care, but you can ask 10 doctors, 10 nurse practitioners the same question, 10 PAs the same question, and you're gonna get different answers. Everybody manages and does things their own way. So, and even me, like I work with 11 different surgeons. Every time I have to learn their attitudes and like their way of going about patient care. And so I don't, as a bedside nurse, get frustrated when I know that I need something. Sometimes I don't agree. Like sometimes, okay, example. I had this patient with a possible GI bleed, no longer had this GI bleed, and I was still on a Protonix strip. As an ICU nurse, that annoys me because I'm like, oh, come on, Protonix doesn't mix with anything. I need a line, like an extra line. Can we please go to 40 BID? But that's not up to me. I'm not the provider there. I am the bedside nurse. So even though I know there is a different treatment plan, I'm not gonna sit here and fight with the provider because I know my role. I know my place and what I'm doing there. So that kind of like ties into like court. If I go to court and like they're like, well, you knew this wasn't what you were supposed to be doing as a nurse practitioner, it's like, yeah, but I wasn't the provider on the case. I was the bedside nurse on the case. So I don't know. I know it gets really touchy. I'm not worried. So I just know to stay in my lane. One thing looking back was I created a lot of anxiety for myself. I wish I would have trusted myself a little bit more, but I think it's just like your confidence as a new provider. One thing that I absolutely love working in a facility and having an attending and having this hierarchy is that I have a comfort zone, and as a new grad, I feel like that is a really good thing to have. I always have somebody to fall back to and to ask. One thing that I did have to learn that I did struggle with a little bit in the beginning that kind of shook my confidence was that I was like, I didn't know what I can order without the doctor. And now I have to consider insurance. I have to consider resources. I have to consider many other factors. So let me give you an example of what I'm talking about. I was in the ICU one day, had a patient come in with Ludwig's angina. If you don't know what that is, it's inflammation, infection in the mouth. And this person came in in the ICU, literally on room air, just for airway management. So I saw the patient in the morning and I wanted to do a swallow eval, but I was like, maybe I should get speech. I thought a bedside swallow would suffice. A nursing bedside swallow, but I was like, this patient is clearly here for airway protection. Maybe I should get a formal speech therapy eval just to be safe, because the last thing I want is this person to aspirate. However, I was like, ugh, do I ask the attending? Well, I'll do it in rounds. Well, we didn't end up getting to that patient in rounds until 12. And then the attending agreed with me, go ahead and order speech. Well, by the time I ordered the speech therapy, it's already in the middle of the day. Speech therapy is not gonna come till the next day. So I fought with myself and I was a little angry with myself because I was like, I could have ordered this early in the morning. Speech therapy would have came. They would have saw the patient, and the patient would have had a diet by the end of the day. And but then the other side of me was like, is the attending going to be okay with that? Like, should I just be like, why am I wasting resources and like spending money and like getting insurance involved and like all this like approval and stuff for this, when the nurse could have done a bedside swallow 5 minutes and the patient, if they passed, would have had a diet. But it's like, now these are things that I have to think about. So because of that, I was a little upset with myself, and the patient the attending ended up agreeing with me and told me to go ahead and get a formal speech eval. And then I was just mad at myself, like, I could have ordered this hours ago, but I didn't want to waste resources. But at the same time, like, I didn't want to charge a patient, like, you know, for this, like, another thing on their bill. And so I just wish I would have trusted myself a little bit more in the beginning. So that, I think, is a perfect example of like what I mean. And another perfect example of how different providers would think differently, because what if I had a different attending that day who was like, no, just do a bedside swallow, they're fine. You know, you just never know. Another one of my mental struggles was finding out how broken our system is and how much it sucks for people who don't have insurance, people who are immigrating. And I'm not just talking about people who like immigrated here or here illegally. I'm also talking about people who are here, who are visiting on a visa, or they're like on vacation and I can't get them the proper treatment. So let me give you an example, a couple of examples of why it's frustrating as a provider and how it kind of makes me feel bad as a person. I had several instances where I've had patients who didn't have insurance, whether that was because they had just recently lost their job, whether that was because they were an immigrant, whether that was because they were traveling here from somewhere, or because their insurance doesn't cover a specific thing. So a couple examples of that. Had a patient, no funding, had traction on the leg, told me that they didn't have childcare and they have a young child and there was no way they were going to be able to take care of the child and, you know, go about their day while being hurt and having this traction. And it was like an issue and they needed to go to an acute inpatient rehab, would prefer that, but had no funding for it. My hands are freaking tied. What am I supposed to do as a provider? Another problem was one time somebody had like a DVT, was going to send them home, but couldn't pay for the medication. Eliquis and Xarelto is like $400 a month. Is this patient going to be able to pay for this if they're young and don't have insurance? But I have no other options. Like, and it's like, great. Is this person going to eat and pay their rent, or are they going to take care of their blood clot? Like, it just sucks as a provider sometimes to realize like you want to help your patient as much as possible, but sometimes the treatments that you are prescribing are very costly and not everybody can afford it. And it just mentally, it makes me like sad, because I grew up poor as well. Like I told you, I'm from the projects. Like it's really sad and unfortunate that this is even a problem. And it just makes me so mad that in other countries, drugs are so much cheaper. And here in America, they're so expensive and it doesn't make any sense. So it just like realizing that the system is so broken and wanting to do what's best for my patient, but having so many things factor in and tie in has been such like a frustrating part of being on this side of the medical field. Because when you're a bedside nurse, you don't think about insurance. You don't have to worry about this. You're not working with social work and case management in this aspect of like trying to get everything set up. Like, my job is to take care of you and pass pills and like make sure you're not in pain and like make sure your vitals are stable. And it's just a very different world when you come to this side. Some advice that I do want to give is I try to be the best provider I can be. I want to be the provider I want to work with. And in turn, this kind of gets frustrating because I still am a bedside nurse, but stay humble. Know that you don't know everything. I don't pretend to know everything. I don't ever really tell people that I'm a nurse practitioner. I always say I'm a nurse because I am technically a nurse first. I'm a provider second. But one thing that I always, becoming a nurse practitioner made me a better bedside nurse, and being a bedside nurse made me a better provider. And I'll give you examples of that. When I met my nursing job, now that I know what it's like to have a long list of patients, you're so busy, you're trying to discharge, you're trying to write all these progress notes, and you're trying to make these orders. Now that I know what that's like, getting phone calls, text messages for little tiny things interrupts my day so much. So as a bedside nurse, now that I know that, I try in the morning to make my plan of care so that when the provider does round, I can limit those phone calls and only call in emergencies. And I appreciate that so much being a nurse practitioner, because it like doesn't spend a lot of my, I don't have to spend a lot of my time like talking to my nurses and getting things clarified. But also because of that, as a nurse practitioner, like I said, I want to be the provider that I would want to work with as a registered nurse. So what I do whenever I can, in the morning when I go, I'll find my bedside nurse. I'll say, hey, I'm Christina with trauma. This is my extension. Please call me if you need anything. And I always ask, sometimes I get there early enough to talk to the night nurse. So I always say I always ask 3 questions. Do you need anything? Do you have any concerns? Do you want anything? Why? Because I know how much I value when a doctor asks me as a bedside nurse, how did the patient do? What are your opinions on it? I really value when the doctor takes my opinion into consideration and really trusts me. And if I say something, they believe me. So as a provider, when I'm rounding and I'm looking for my nurse and I find them and I ask, how did my patient do last night? I want to know what your concerns are. I want to know if you need anything, whether it's pain medicine, blood pressure medicine, restraints, what can we do better for this patient? I like to have that interdisciplinary collaboration. So to me, that means so much when I'm a bedside nurse. So that's what I try to do when I go round. I want to get to know my nurses. And to be honest, I've learned so much now that I round. It pays to have a good nurse taking care of your patient. It really does. It makes or breaks your day. So I want to establish the best rapport I can with my nurses and my team. But in turn, there have been some times that I get so much attitude from the bedside nurses, or they fight me on something, or they don't agree with one of my decisions, and it is very frustrating. I've had some nurses question my judgment, go above me and go to my attending, and it kind of makes me upset because I'm I'm very approachable, I am very nice. If you have a problem, and you have every right to question my judgment, I'm not saying that, but ask me why I'm doing things instead of just going to my doctor and telling, trying to get something. For instance, I one time was treating hyperkalemia for a patient in the ICU, and I ordered bicarb, dextrose, insulin, and calcium gluconate, and the bedside nurse did not come up to me and approach me and ask me why I thought this was why we were giving this. Instead, he went to my attending and was I did the albumin to calcium calculation and this patient does not need calcium. And I'm I'm not giving calcium because the calcium's low. I'm giving it to bring down my K level. If you would have just asked me instead of going and reporting to my attending, there's a hierarchy here. I get it, if you have questions, you have every right to question me, but ask me first. Why do you have to go above my head? I don't know. It was a little peeving. And I've also had nurses who I asked, hey, I made the pain medicine, PRN every 4 hours, but the patient is telling me that they're still in pain. Is there any way you can give them a schedule? Is there any way that you can ask them before they ask you if they're in pain? And this nurse flat out said, well, if I'm busy, good luck, not gonna happen. And I'm that is so frustrating to me because I'm still a bedside nurse. I still work the floor, and I know what can be done and what nurses are being lazy with. And I'm and I understand being busy. I do it. So it can go both ways. And in that sense, I wanted to touch on another topic. I feel if you are going to work both, or you work with people who know you're a nurse practitioner, I get a lot of shit from nurses. I actually thought I was going to get a lot more crap from doctors, being aren't you an NP? But I actually get a lot of stuff from bedside nurses who are always you don't know this, aren't you an NP? They throw it in my face. And I'm do you know what my training consisted of? You don't. One time our stroke coordinator was joking with us and she's how do you not know how to read these scans? Aren't you an NP? And I just laugh because I'm I'm a trauma general surgery NP. I'm not a stroke nurse practitioner. I'm not a neurosurgery nurse practitioner. So like, yes, I could read the basic head CT, but like, I don't know perfusion scans. I don't know that. Like, what do you think they teach me in NP school? Like, it's just so funny to me. Or, okay, recently I went to go get my CCRN. Everybody was like, oh, you're gonna pass because you're an NP. Oh my God, how could you not pass? You're an NP. And it's like, just because I'm an NP doesn't mean I'm gonna pass this exam. Like, there are people out there that are shitty test takers. And I ended up passing, thankfully, but I was like, God, what if I don't pass? How embarrassing. Like, all these people are putting all this pressure on me, like, oh, you're an NP, you're supposed to know this. It's like, don't take that to heart. Have some thick skin, because nobody knows what you actually learned in NP school. A lot of the stuff that I know, I actually feel like I know because I've been an ICU nurse for a very long time, not because I learned it in NP school. So I don't know. I just like, I laugh and I never take it personally anymore when people are like, don't you know this? You're an NP. I'm like, what does that mean? Are you gonna ask a urologist a cardiac question? Are you gonna ask the nephrologist a question about the brain? Like, no. Like, just because I'm a nurse practitioner doesn't mean I know everything, and I don't pretend to know everything. And that is another topic that I want to talk about: remaining humble. I do not, and this is kind of why I don't tell everybody like I'm a nurse practitioner unless I absolutely have to. I know I don't know everything. I will never know everything. I'm constantly learning, and that is one thing that I absolutely love about being in a level 1 trauma facility that is a teaching hospital, because I learn so much every day. I learn something new every single day. I also learn a lot from other disciplines and other people and other, like one time an echo tech was like, what are you looking for on this echo? And I was like, oh, vegetation, like we think that the patient might have infectious endocarditis. And she's like, well, your blood culture is positive. And I was like, why are you asking? Like, and she's like, well, you can't have infectious endocarditis without positive blood cultures. And I was like, you actually can. You can have vegetation, because I have seen it with negative blood cultures. But like, you know, I learned that from them. Or CNAs. CNAs teach me something new every day of how to change a patient more efficiently, how to do something more efficiently. So like, I will always listen to, just because we are of different degrees, certificates, like different levels, I don't like think I'm better than anyone. I don't think like, oh, you know less than I do. That's just not true. I've worked with some CNAs that are doctors and nurses in other countries, but they just didn't want to get the licensing here, so this was the easiest thing. So I just, be humble. Don't let your degrees define you. It was another thing that I realized when I started like traveling out the country and doing like my spiritual growth this year, was that when I go to another country, I don't know the language. My degrees are not valid here. I am a nobody here. Like, if I needed a job, I'd start at the bottom and probably have to go through school all over again. So I realized that I am more than my career. I am more than my job. I am more than my degrees. There is more to life than work. And I learned that the hard way, because like I said, mentally working so much, I almost lost everything. Like, I worked so hard to go part-time at my job, and then a few months ago, they almost laid me off because they were doing major cuts. And I thought that I was going to get laid off from my nursing job. And then I thought like, oh my God, am I going to have to give up my NP job because my NP job's so far? Like, it wouldn't make sense to stay here. Like, I have to get a job somewhere closer. Like, oh my God, I went from having 2 jobs and working 6 days a week, and now I'm not going to have any job. And I just realized, after all the emotions that I went through and crying and like trying to get part-time and staying at my job, I just learned that like, I love being a nurse more than anything. I like being a nurse practitioner. But at the end of the day, you have to have a work-life balance. You really have to realize that there's more to life than just work. And if I were to lose everything tomorrow, like, being at home is more important to me than my job. So I got to a point where emotionally I was like, you know what? I fought so hard to stay at this job part-time. If you lay me off now after all that, do it. I have no more tears to cry. I don't, because you're just a number at the end of the day. A job will replace you like this. They will have someone else in your position tomorrow. So I learned that I've always had like a hustle mentality. I've always worked full-time. I've always gone to school full-time. Like I've been doing this since I was 16 years old. I'm now going to be 35 in January. So I struggled with that at first because I was like, I'm always used to working so much and having 2 jobs and going to school and doing all this and having so much on my plate that now at this point in my life, I'm like, just want to chill. Like, this is why I'm like, I would do my 2 days of nursing and do my 1 day as per diem as an NP, because being at home with my husband and my animals and like just starting a life and doing things, I have to balance it. But anyway, hope you guys like this video. If you have any questions, leave them down below and I'll answer them. And good luck to you guys if you are starting this journey. Bye.